Section 3 considers the application of human rights to advance disease prevention and health promotion. For the health and human rights movement arose out of the early years of the AIDS response, as noted by both Larry and Flavia thus far. We begin focusing in Section 3 with Sharifah Sekalala and John Harrington, who examine how human rights have been applied across an increasing set of communicable disease threats. Considering the importance of human rights, especially now, as we see a shift toward global health security in the COVID-19 response.
To talk about Chapter 10, which is the chapter on communicable diseases. Communicable or infectious diseases are spread across populations through physical contact with animals or people. The three main approaches to addressing communicable diseases, as we discuss in this chapter, a public health approach, which is grounded in scientific and epidemiologic understanding of the disease and seeks to constrain diseases at the expense of individual rights. And this often allows compulsory screening, movement restrictions, and mandatory treatment. The AIDS epidemic in the early 1980s fundamentally changed this approach because it made it really clear that there were serious questions about the efficacy because people merely went underground. But additionally, it created coercive attempts across marginalized groups, leaving them more vulnerable to HIV/AIDS. And the third approach is the securitized approach, which John will talk about. We make two fundamental points about human rights being fundamental to the spread or to the containment of infectious diseases in this chapter. The first is that human rights approach is essential to protect vulnerable groups. And we see this in the way in which in which the COVID-19 crisis has disproportionately impacted on vulnerable groups, such as groups, Latinx groups, Black groups, and groups who are poor and the elderly, meaning that a human rights approach must be fundamental. The second is that it helps us to make the case for access to essential medicines. And we did this with the AIDS pandemic, but also later on for tuberculosis and malaria. And these arguments we are seeing again with the COVID-19 vaccine. And so they're really critical to the way in which we think about infectious disease.
As you said, there's a contest in this area of communicable diseases between a security frame and a human rights frame. A security frame, which is long established into the 19th century, prioritizes the interests of the nation. It focuses on borders. It focuses on excluding people from the territory as a whole or particular territories, puts a premium on coercion and force. A human rights approach, guided, for example, by the Syracuse Principles, places much greater emphasis, as we say in the chapter, on the rights of individuals, and also on the idea of proportionality. That is, that measures taken have to be based on solid science. So the AIDS pandemic is not the same as the COVID-19 pandemic, and therefore the human rights justifiable measures may be different. And that these measures are necessary and no more than necessary to combat the disease. The legal regime that we talk about, which has come into the news very much now with the COVID-19 pandemic, is the international health regulations of the World Health Organization, which were revised in 2005 to bring them up to date and to move away from this strong security frame and to include for the first time ideas of human rights that we've just mentioned, and this idea of proportionality. The COVID-19 pandemic has shown that human rights are important, that people have recourse to human rights when they want to talk about what's going on and to criticize it. So the principles that we set out in the chapter are very much relevant now, but we also make clear that this regime needs to reflect human rights even more strongly. The human rights need to have more teeth to be more enforceable. And a particular area of interest for us is the situation of countries and people in the global south where states lack strong capacity in many cases to protect their people against infectious diseases. There are some mention of this in the international health regulations, but again, it's not enforceable and it's not well defined. And COVID-19 has made very clear that these obligations of solidarity need to be made stronger and more enforceable.